Hi, everybody. Welcome back to the Solidarity Trust Make Your Mark series. This is the third in a series of comms that we'll be giving out to the nation of Zimbabwe and beyond on all things COVID-19, talking to trustees, medical professionals, legal professionals, and captains of industry involved in various ways with fighting COVID-19. The last time I was on, I used an analogy of generals in an army and this being a battlefield in which people are needing to play various roles. And with the amount of developments we've had this week, statutory instruments being introduced, the easing of lockdown, the big question is, what next? Darlington, you're off the hook this week. You're not going first. This time, I'm actually going to start with Karen. Karen, I'm curious to find out, and I'm sure most of Zimbabwe is, with businesses opening again, and there being a lot of panic around what these statutory instruments mean for organizations, for employees. And I'm talking specifically about SI 99, which has had a couple of iterations since. Being close to the ground, what are you advising organizations to think about in terms of, their response to, say, testing requirements and just business operations more broadly?
It's been quite a challenge. When the statutory instrument first came out, there was a lot of, I would say, panic, and people were very confused about what to do and not quite sure. So there was a lot of lobbying, and business, CZI, the mining industries, many industries got together, and there was a lobby and many letters and communication that went to the ministry, the ministerial task force. And on Tuesday, there was then an announcement that this was no longer mandatory for companies because they just can't afford it. It's just much too expensive. And so we were very thankful to the Ministry of Health that they really were listening to business, because it's just such a challenge. Business has already been shut down and they had no income whatsoever. And for them to now have to outlay, for some companies, hundreds of thousands or thousands of dollars, any amount at this stage is just not practical at all. So we then have been quite, not relaxed, but we were able to get going in terms of opening businesses and just practicing the rules as per WHO guidelines on washing hands and making sure that everybody is distancing, social distancing, and wearing masks, and being very deliberate and very careful to make sure to protect the workforce as well as the clients. And then this morning again, there's been another response in the Herald about 2 more statutes, which we're hoping is a miscommunication that's been released by the Ministry of Health, and that it's not going to affect businesses from continuing, because even those who have already didn't lock down because they were essential businesses, for them to now go and have to start testing would absolutely cripple them. And further, it's what we were told was that it's going to be where if companies could afford it and they did have access, or the ministry was going to be able to provide the testing for free, then only would people and companies have the decision to make on whether their staff would be tested or not. So we will wait to see, but at this stage, like I said, we are hoping that it's a miscommunication and that people can go about and start to slowly ease down on getting back into business.
And there will be a multitude of complexities around the original statute. And I'm going to turn to you, Dr. Francis Lovemore, to just talk us through, the testing requirements were quite rigid and actually quite frightening if you think that the cost of testing kits, for instance, are prohibitive for the average company. Couple that with the Forex requirements to actually buy those kits. And then there's the whole debate around the efficacy of the testing that's being proposed and its integrity. What are your views as a medical practitioner on testing and what is practical, what works, and what people actually need?
So thank you very much, and thank you for the opportunity to really talk through what testing means. And the thing with the COVID virus is that the test that you take is only valid on the day on which you have the test, because you can go straight out and be infected with contact with somebody else, and within 5 to 14 days you will exhibit signs of COVID. So a 30-day testing cycle is going to miss a lot of people. I think one of the things that people are missing is there's a difference between testing and screening. And screening is when you're measuring the temperature and doing a short questionnaire about contact, etc., which in fact gives you an overview every single day of whether your worker has risk to the rest of the workers. And I think this is what the companies are worried about, is the risk of the disease moving through the company. The use of the rapid diagnostic test kit, as is being recommended, is not a wise decision at all, because the rapid diagnostic test kit is not validated for picking up early signs of the disease. You will only seroconvert to showing that you have the disease 4 to 7 days after you become infective, and that I emphasize that word, infective, to the rest of the population. So if you're testing somebody who's been sick for a week and they test positive on the RDT, you've missed 7 days of their risk. The effective test for active disease is what's called the PCR test, or the polymerase chain reaction test, which tests for the virus. And that becomes positive 24 to 0 hours before you start exhibiting symptoms. So recommending the routine testing of every worker every 30 days is not really going to contribute to controlling the disease. It's going to give the state or the Ministry of Health an idea of the prevalence, but it's not going to act as an effective protective mechanism for the working population.
And Dr. Murisa, if you could jump in then and talk about the alternative. So we know that, recommendations have been given around sanitizing, washing hands, social distancing, but there are some industries where that's actually quite a complex ask. What are your concerns as a business person around, or a person in industry, around sort of the practical implications of people returning to work?
Oh, thank you so much, Mucha, for having me. I think the discussion, as Dr. Francis has already shared, it's a very complex issue that we're dealing with. And there are so many unknowns for all of us, especially laymen like us who are not in the medical fraternity. There's so many things that we have not been given. So I think what we're doing through Sotzim sort of helps in terms of saying, let's have a publicity campaign, putting all this information that Dr. Francis has just given us to everyone. So for us is to say, how do we reach out to the captains of industry, those who are running firms, those who are engaged in public transport? How do we make sure that some of the stuff that we're being told about making sure that we have access to running water, we have sanitizers, we have gloves, we have masks, how do we make sure those are available? Because the challenge is also the availability of those. And the mask, I just talked to general workers now. I saw him without a mask. I said, why don't you have a mask? He says, I was given one and I've washed it. So how do we make sure that we continue with those cycles? Because I think the battle is going to be fought when we sort of follow these public health methods that were being given around hygiene, etc. Because the testing, like she has already told us, is actually, it's something so complex. Others are treating it like it's an HIV/AIDS test, that you take it, then you come back after 3 months. But as we have been told by the experts, that's not the case. So we have to go back to talking about this, how it spreads, and how we can sort of exercise the public hygiene. I think the war is going to be fought around exercising public hygiene.
And the role that Sotzim would play is an advisory role then to industry around best practices, just making sure that organizations know what's happening in industry and how best to kind of position themselves to protect their workforces.
Yes, beyond industry though. I'm beyond industry. We think that citizens in general, because the communication platforms we've been using, we are talking to each other, but I'm not so sure if we're reaching out to everyone. So if you're on WhatsApp, your group is limited, etc. So we're actually beginning to be rolling out billboards and other popular platforms for communication to make sure that this information is out there.
And as a citizen, I might have alarm bells going off in my head that I will probably get arrested if I leave home without a face mask, but PPE is not easily accessible. Darlington, in your work building out St. Anne's and the various medical centers, what is your kind of thought around the PPE aspect? And then if you could go on and give us an update on what's happening with these healthcare facilities.
Thanks, Mucha, and welcome back. You mentioned the issue about this being a war, and Tendai also mentioned the issue about war. And I can imagine we're in a situation where Karen is flying the jets and Dr. Lovemore is in a tank, and Tendai Murisa is running as a foot soldier. And then here's my role. I come and I give them water whenever they need water and so forth. So that's how I see even the role that we're playing with PPE. We cannot do this without PPE. And, we've heard so much about different PPE that's been sent to the country. We've got nothing. So we've had to try and come out with homemade products. And we've got some products. We've got a form of PPE that we've got, which is a PVC, which is washable and can be reused, which is good for us if we could use that and get it to work, because then we can save on money. But the problem with that PPE is that it's quite heavy, and you can imagine you sitting, or standing in that PPE for 6 to 8 hours. You'll be a mess once you're done with that. So we're trying to figure out a way that we can get PPE that's adequate. For St. Anne's, for example, we're saying we won't open without at least 2,000 pairs of PPE. So we're working on that, and we're trying very much to engage government, engage the private sector. Guys, let's see what we can do. And people are helping. People are coming with different samples, and we believe we're going to make it work.
And this is a self-sustaining production, is it? So it's all happening in Zimbabwe?
Yeah, we've got some people who are bringing stuff that's imported, but we've got quite a few people that are making PPE locally. And what you're trying to do is that we've got guys who are making visors, which are better than goggles, as you know, because goggles mark your face. You're wearing those things for hours. So people are getting on board. And I just have to commend people for doing what they're doing. But guys, we need more. So if you want to donate PPE. That's one of the most important things that we can get. Donate some PPE to us, and we'll use it wisely. Mm-hmm. Moving on, let me talk about St. Anne's. I want to tell everybody out there that we're getting close. We're really, really close now. We are jumping for joy. We started doing training today. We had 8 hours of training. Our IGNs are in place. Our sisters in charge are in place. We're just doing finishing touches. But I can assure you, infrastructure is at about 90%, if not even 95%. But there's certain areas that we still need help. I want to talk about, and maybe some of my colleagues will also talk about this. We've raised a total of $265,000. We've got pledges of $255,000. There's a lot more that's coming. I'm going to let Nelly talk about that. Nelly's going to talk from finance. She'll talk about that. But I want to talk about specifics. Pharmaceuticals. We need a lot more pharmaceuticals to put in place so that when we open, we have them. We need issues like equipment, clinical equipment, thermometers, a lot of stuff like that. We need that stuff to be also in place. Sundries, we need all that stuff to be in place. So guys, I keep talking about it. Donate. Guys, get in touch with us. Help us get ready. It's important for us to be ready, and would like to open in the next few weeks. It could be anywhere between, it depends with what happens with PPE, and it depends on donations. But within the next 10 days, would like to be up and running.
Nelly, with your legal background and your contribution as a trustee for Sotzim, you're quite heavily involved in the governance and the finances. Could you just walk us through where people's money is going and what key messages you'd want populations that have been donating to be aware of?
I was laughing because they made a lawyer the head of finance.
I thought it was quite ironic.
It is.
Board.
Yeah. Well, I think our organization is so blessed because we have so much support from everyone, whether it's a resource, whether it's money, whether it's donations. Everyone is just coming and chipping in a big way. You've seen our target, you've seen where we are right now, but I want to celebrate a few more monies that are coming through. CBZ has given us 6 million Zimbabwe dollars, and that's going to go a long way. We have 400,000 from Pro Plastics and 20,000 US dollars. So I'm just talking about what's happened in the space of Monday to Wednesday, because I don't have the full picture of today. So you're just seeing a snippet of what's been happening. I'm really excited with the passion that is being shown. Our suppliers have been amazing. You'd think that they want to make profit, but they're the ones who come to you and tell you, hey, hang on, we're going to do this at cost. Karen, like our potential PPE guy, right, at cost. That's what I can say on finance. So keep watching the numbers, keep donating. Every single dollar counts, whether it's a $1 Zimbabwe, but if it's a million of those $1 Zimbabwe, they'll go a long way.
In an environment where, those numbers may seem like huge numbers, so you might well have a person who thinks, oh, actually, they've got all the money they need. There's no point in giving any more. Let them work with what we've provided so far. Karen, I know you're itching to say something about this right now. Could you jump on in?
Yeah, thank you so much. So yes, we've had fantastic momentum. It has been incredible, the support that has come through. But it's so important for everybody to realize that we've just started the engine from a huge, big 4x4. We should call it a tanker that's been sitting and has not moved for many years. And we've just had the engine serviced and we've just started it. And we're ready to go into first gear, which is where Darlington is, right now. They're in training and they're basically going into first gear. And to take it to second and third, etc., is going to require additional funding. So we really need for people to understand that it's not that we have access to huge sums of donations or money, or we've got access to donor funds from all the different donor organizations, etc. That would have, initially we thought that was going to come through, especially because we had an MOU with the Ministry of Health and with government who've given us an MOU. We thought that with having that, we would have access to some donor funding from the embassies or from the diplomats or from the big multinationals. But we very quickly, in the space of a month, which is what we've been operating, actually a month now, we've realized that that's not happening. We're going to have to do this as Zimbabweans from across the world together. Get us to second gear. Once we're in second gear and we're now able to start accepting people who are coming to St. Anne's, for example, we need to be able to then operate. We need an operating budget for the next 3 to 6 to 9 months, but not even that. I've just seen a question where somebody was saying, what about Bulawayo or the other centers? We want to be able to, solidarity is not just about Harare. It's about all Zimbabweans. We want to be able to help the Zimbabwean people in Bulawayo, in Goromonzi, in Binga, in Mutare, but we can't do it if we don't all come together and actually contribute and help and be united in this common purpose. So don't say, you know what, it's fine. I can sit back and relax because Ningiriki or so-and-so is going to be the one who pull out of their pocket. This is going to affect all of us. Wherever you're living, I'm sure you've got a family member who's still in Zimbabwe. I'm sure you've got a cousin or a relative or your grandmother. They all are going to need support. They're all going to need help. And it's not about, because the disease doesn't look like we've had any increases in numbers, we're okay, we're out of the woods. We're not out of the woods, people. We are not out of the woods. The potential of it still to be it's a pandemic, to be an absolute disaster is very real. So let's not take it for granted and let's not push the buck onto other people. Let us each take responsibility and let us each contribute and help one another. Together, we can at least help one other person.
And it's really important to recognize that Sotzim can't be all things to all people. So all these efforts do require participation from a broad spectrum of Zimbabweans, both home and abroad, as you quite rightly point out. We have got a question online from Nico Aboti asking, I'm a media specialist. How can I help you make communication materials and push Zimbabweans to donate? Who can take that question?
Okay, so I head up media. Sorry, it's me again. Nico, I would love you to DM me and I'll take it up with you. We'd love we need help in terms of printing material for educating the public and going on the radio. We'd love to get onto all the radio stations that can reach the population deep down Kumusha and around the country, and we need billboard material. So if those can be printed where we don't have to pay for it as well, that would be a huge help. So please, whatever you can do, DM me, send me a text, WhatsApp, and we'll welcome it with open arms. Thank you.
And to add on, that helps me have more money to use for other things. So, we have got this budget for media, which I really would like to see come off the budget, because somebody like Nico has come and donated, whether it's time, whether it's materials, whatever it is. You're creating more funds for another area that I'm trying to pay for. Thank you so much.
So we've spoken about St. Anne's. Darlington, I'm coming back to you to talk Marlborough and Arcadia, because you are doing some work there as well. And yes, there is Binga, Goromonzi and elsewhere, but let's talk about the centers where there's actual activity at the moment.
Thanks, Mucha. I'm going to jump on what Dr. Lovemore talked a little bit about. And in fact, Karen talked a little bit about it as well. That's testing. I want to say this, Mucha. I'm concerned because I went down since the last 2 days. I went down to Southerton, went into Mbare, went onto Seke Road. And I'm seeing a lot of people on the roads. Worse still, I'm seeing a lot of people gathering together, whether they're in queues and stuff like that. And yes, I'm seeing a lot of people wearing masks, but there's certain people who are not bothering wearing masks. And it's so important for us to be able to keep encouraging our people to do the right thing. And if not, then we're going to find ourselves having to make tough decisions again to make sure that this thing doesn't hit us. So one of the things that we wanted to make possible was to have places where we could do testing, PCR testing, where people could go out and have tests done. And then if they're found to be okay, then obviously they can go home. But if they're found to be exposed, then we can quickly get them to places where they can get help. So Marlborough is such one place. We've just started doing some work there. We're looking to have it ready early next week, Monday or Tuesday. It will be a drive-through testing. So as you drive into the complex, we're going to spray your car, spray your tires, you drive up to the canopy, we do our swabs, we collect our swabs. In fact, I should use the word collection of swabs as opposed to testing. We collect just the specimens, and then as you drive out, we spray your car again in certain places, and then you're gone. Same thing that we want to do in Arcadia. Arcadia will obviously service places, people coming from the south. Marlborough will service people coming from the north and the west. Hopefully, these will be two such places of many other places that will be put together so that we can have testing. Testing is really crucial. We're not doing enough of it so far, and we're not doing the right type of testing so far, so we need to do more.
I'm going to turn to Dr. Lovemore and ask you, with a lot of focus on the physical health as COVID-19 kind of attacks the body, there are concerns around mental health, which aren't often addressed. And Zimbabwe doesn't have a great track record of mental health care. I'm a little bit concerned reading accounts of nurses potentially taking industrial action because they're concerned about, their well-being. Could you talk to mental health just generally for Zimbabweans, both in the medical profession, in the medical field, and just generally?
Thanks very much, Mucha. So I think the real concern is that the situation created by this pandemic has created a lot of fear and a lot of anxiety, which pervades throughout the population, but particularly in the health fraternity, particularly when you look at the casualty figures in the UK and the US, where the frontline medical workers have been the most affected by exposure to the virus, and they've had a significant number of deaths. So the anxieties of the healthcare professionals here in Zimbabwe are very real, because there is a shortage of protective equipment for them, and they don't feel supported. They don't feel as though they are respected or that their work is of value. And this has quite a serious impact on somebody's ability to come to work and to do a good day's work and to feel committed to patients who are equally distressed. The risk of the virus to the victim is a significant risk. 20% of people will be seriously ill, and between 1% and 5% of people may well not make it through the disease. And plus you've got the risk, the mental health impact of being isolated, of being quarantined, of being removed from your family, of the risk of dying on your own. All of these create enormous anxiety in every part of the population, whether you're in the leadership or whether you're on the frontline health workers. or you're a potential victim of the virus. And the mental health support required for this is going to be complex, because there's been a fair amount of literature in the last few weeks around how even the therapists feel helpless and hopeless in trying to offer mental health support to people who are anxious, because they're in the same situation, and you add the impact of economic anxiety onto this, and you've got a highly distressed nation. So at this particular point, I'd like to say, it would be important for particularly for our leadership to take a bit more of a rights-based approach to how they tackle, how they communicate with the population, a bit more concern about people's welfare, and a little less of this bullying, we're going to arrest you and throw you inside for 12 months because you haven't had a test. The level of anxiety in this country is high anyway. There's many obstacles to run a successful business. So the sort of general psyche of the country needs to be looked at, I think, more carefully by those who are in leadership at the moment. And we're sort of banging our heads against the issue of how to create mental health support programs for everybody. But when you're faced with so many challenges, you're really looking at how do you create communities who can support each other. How do you create communities who can help each other make masks? How do you create communities who can help each other with hygiene, quarantine, all of the anxieties? How do you create communities that are cooperative rather than competitive over access to food packs, food parcels? How much people have been watching about South Africa, and people who take donations in then get their vehicles burned down, and that is a sign of a really distressed population when you're sort of biting the hand that's trying to feed you. As professionals in this fairly frightening situation for a lot of people, we need to be working very hard on making our messaging not threatening, but encouraging, really encouraging Zimbabweans to help the government to contain this pandemic, rather than the risk. And as you were talking about Darlington earlier, you go into communities and they don't feel supported, so they are being slightly rebellious. They don't know how to behave as a community and look after each other and prevent people getting too close to each other. Because they're competing over access to maize meal, access to cash, access. The day of the life of a Zimbabwean is one of great competition. I am constantly seized with, how do we effectively create systems where mental health support is not necessary, that we're giving it to each other. That our daily interactions, as whether you're the factory worker or the supermarket. I mean, I don't know how much people think about supermarket exposure. Those till operators are in a highly stressed environment. And how many people say, hi, did you have a nice day? How are you? So, yeah.
So
I'm going to
sorry, Dr. Francis. I was going to say that we've also been very blessed in that we've managed to get insurance cover for the health workers. It was extended to us, I think it was through Old Mutual, and Elsie, who sits on the board at St. Anne's, one of our representatives, was also able to get insurance cover for the health workers, which is a great help, and they need that. And, going back to St. Anne's, we've got this huge budget, and a lot of that budget is for the welfare of the nurses and doctors, as well as for the hotline. It's for their welfare too, as well as to provide them with things like accommodation and so forth. And we do have a few volunteers from, psychologists and therapists and counseling. The Christian Care Counseling has offered free counseling for the nurses. We also have the Island Hospice, who we've engaged, who will also be able to offer counseling. And I think that's going to be a great help to the health workers. But again, like we was talking about, the hotline is really important. But the health worker, the nurse, the doctor, if they have to come in and work and treat people, it's really, really important for them to be able to not go home, for example. So the hospital is looking at making sure that We've got accommodation for them to stay there and support them as well. So you're very right, Mucha, that the mental health issues, counseling, making sure that they get all-round 360-degree support, not just the health workers, but even just our general people who work with us in our organizations for some of the businesses. We have to make sure that we give them that counseling also and support, because they've got all of the stress that's going on. So like I was saying, those two organizations, the Christian counseling, we also have Island Hospice, etc. That's very important. But the police force as well. I was going to say, I don't know if there was anybody here who was going to talk, but they also need to be supported, and they also need to be educated on how to handle the public. And, they need to be shown on what kind of mask they should wear. And, I think that sometimes laws are put in and the implementation of how they're put in is not really discussed, and they're not trained. The police don't get the training, and then they just go by what they're told. And if they don't arrest people, then they get accused that they haven't arrested anybody. If they arrest, if they do then arrest the people, they then get accused of being corrupt. So it's really, really trying to find a solution to making sure that the police force get educated and they become trusted by the people. It's really important that the police begin to get trusted, that people trust them. But that can only happen where there's collaboration and education for them too.
Absolutely. I had the privilege of speaking to a group of dynamic doctors, Zimbabwean doctors based in the USA last night, and their accounts of working on the front lines are absolutely harrowing. So this mental health issue, it's one thing, it sounds a bit lofty at the moment because we haven't had a surge in cases in Zimbabwe, but certainly something that we ought to be proactive about, where we start really thinking before stuff blows up, what we're going to do, how these helplines will actually support our healthcare workers. We have Rhoda Deketera online who wants to understand the corporate governance structures around donations. Nelly, one for you. So Rhoda's trying to understand how we address declarations of our donors and what visibility there is over donations at a granular level.
So because of the various donors that we have, the big, the small, from the onset, we've always said we want to be completely transparent about how we use each and every dollar. Even before we started our relationship with our auditors, PwC, we were already putting in place policies and procedures that are in line with what we viewed to be the best practices, because our team has got accountants as well with so much experience. So you'll see if it's a specific donation of money that's for a specific project. If that donor wants to see how each and every cent has been used, they're able to do so. If you want to see how each and every item you gave has been used, where it ends up, because we do have a lot of in-kind donations. We receipt those, we actually issue a receipt for in-kind donations, and we're able to tell you that when you dropped off your gloves, they ended up at so-and-so. So that's how detailed we are. We also have Ernst & Young as our advisors. They initially had said, we'll give you 2 resources, but after today, they actually have given us 5 resources to assist us, because they've seen that we've got a lot of projects that are not just Harare-based, they're nationwide. So we need to have one person who's looking at each and every area. So I'm kind of selling us out that we've got 5 areas that we're possibly going to be visible in. So it's not just Harare. And we have policies and procedures for procurement, treatment of related party transactions. So even if you want to give us a service and you're one of the committee members, volunteers, it's not automatic that you get Sotzim's business. There's a process that has to be followed. We get invoices, we get quotations, 3 quotations minimum is our rule, and we get the best. It's not about the cheapest, but we're trying to get the best. So there's so much that's there. In our 6 weeks from being born and 4 months of operating, we, I believe, are operating at the standards of someone who's been there longer, because we have to, for being trusted with funds that are from the public, and we're accountable for that.
Absolutely, and that issue of trust is critical. I know of people who feel that I want to donate specifically to St. Anne's, for instance. Is there a way of segregating where people's donations go so that you can respect their wishes?
Yes, our system is able to do that. We've got a great accountant, and we almost have ledgers for those kind of requests. I can't give you the detail. The software provider has not allowed me to do so. But yes, we have a system in place that does that.
Now, with all this said, I would like to know from Dr. Murisa, when Sotzim set its objectives, decided that we want to go for Zimbabwe and protect Zimbabweans against COVID-19, there would have been some objectives, some mission statements, presumably. How well are we tracking against those? Maybe you could actually start by talking about the overarching objectives and then talk about how we're tracking.
Let's start off by celebrating. This is a good story to tell. Like Nelly is saying, 4 weeks old, you have raised so much money. What we can do, like Karen was saying, when we started, we thought, oh, we'll get millions of dollars from these international donors. But we've raised 100% of our funds from Zimbabweans. That in itself is amazing, given where our country is and the international media, how it's covered, etc. Here is a good story to tell, that Zimbabweans from different backgrounds came together to build a hospital, came together to fight a virus. So because we understood from the beginning that we're always going to be by ourselves. So what we had to do was to say, beyond what government is going to do, citizens will have to pull their weight. And this is exactly where we say that never doubt a group of like-minded citizens, because this is where change happens. So what we decided to do was to say, we don't want to get into anyone's space, but we want to help coordinate the different initiatives that are in Zimbabwe. So the first objective for us is around creating solidarity. It's solidarity between what we are doing at St. Anne's, but also solidarity with others in Mutare, solidarity with others in Big Falls, solidarity with others in Bulawayo and all over the country. Solidarity to say, how do we complement what government is doing? So it was never about competing to say we're better than government. So you see that we did not go into areas that government had identified. We're not at Wilkins, we're not at Parry, but we're at St. Anne's. And we're going to those places that we felt like we could complement what is happening. So it's number one, the solidarity. Number two, creating that complementarity. And number three, also making sure that citizens feel like they have a role to play in this fight. So what Nelly was talking about, if you go to our website, you'll see the different individual donors that have given, from as little as 500 RTGS to as high as what we got from our biggest donor, which happens to be a bank. But all these are Zimbabwean institutions run by Zimbabweans, etc. So creating that momentum is so essential for us. The fact that we are 4 weeks old, 6 weeks old, tells something about what Zimbabweans can do when they are united around something. So when it comes to tracking what we have achieved, I think the first thing is to say, look at how much money we have raised. Look at what Darlington has already said in terms of the work we've done at St. Anne's. Look also at the kind of momentum. If you look at our media presence, we have already got a fully fledged website. We're on all the social media platforms you can think about, and we're still going strong. And we've established relationships now in Bulawayo. We're establishing MOUs across the country with other initiatives. So it's just, I think it's just like Karen was saying, it's just work that has begun. And in terms of tracking, I think there's a lot of excitement. We just want to keep this energy going to say there's something that Zimbabweans can do on their own. I think for too long, we spent so much energy in despondency, but this pandemic has challenged us to think through to say, oh, we are on our own here. We really need to fix this mess. And I'm so glad that we've started somewhere. We don't know where we will be in July or we will be in August, but one thing that we are sure of is we will not be where we are today.
And that's really powerful. As a banking professional, there's always a provision made for CSR, and it would be great to see multis and international banks in Zimbabwe who recognize that the governance is watertight, the compliance is watertight, to actually play a role in saving Zimbabwe against COVID-19. So I'm championing the financial services to please get involved, make donations, don't leave it to banks who are already stretched. You've got the provision to do this sort of thing. So come on board. Right, that's my little spiel. Right, so I think as we kind of look to start winding down, there will be people who feel that all this stuff is very high level, quite unrelatable, because I don't know anyone who's caught COVID-19. I need to go out and make money. yes, you've eased lockdown, but I still can't trade the way that I'm used to. What provisions are Sotzim making around just kind of helping the general public with sort of day-to-day living, getting food on tables? And, you know, it may well be that you've partnered with organizations who are doing this, or you know players that could get involved a bit more. You've been doing some work yourselves in this area, I believe. So just talk us through that sort of welfare, the broader welfare agenda.
Who?
I will have anybody.
Okay.
I think that what I want to say to Mucha is that what we're doing right now, just focusing on getting the COVID response places ready, has made it very difficult for us to focus on too many other projects. What we've tried to do is to do, obviously, education. The hotline has been hot. That's the best way of it's been hot. When this issue about testing came along, the hotline was already receiving thousands and thousands of calls, and it got even more calls. But it was able to help people who had questions on testing, and has still been doing that, helping people on testing. Where do I go if I need testing? What is going on, and so forth. So that is how we're getting involved in helping people. Now, I also learned from the people that are working on the hotlines that we've ended up not just dealing with COVID issues. We've ended up giving advice on people who are pregnant, on issues of pneumonia. So the hotline is actually ended up becoming a tool that people can use because they couldn't get to their hospitals or clinics. And so they were able to use the hotline for that. I'm not encouraging that we make that hotline for that. Would like to keep it obviously for COVID, but we will not turn anybody away if there's issues that need to be discussed. So that's one thing. But we have people in our team that have also been doing food packs and so forth, just to try and help out people who are in dire straits right now. But I think the main focus for us right now is to get COVID ready, make sure we've put in place places that people can go to. And once they go to those places, they are treated with the best treatment that they can get, in the most comfortable places they can get. And then we make sure that we take care of our frontline workers. I love the contributions that have come with regards to our frontline workers. I also want to say that for us, we've got the convent that's ready to accommodate our frontline workers. We're putting together a place that they'll be comfortable, that they can sleep and rest well. It's on the facilities, so people can, if we need them for emergencies, we can get them out there and get them working. But it's so important for us to be able to do that.
And I also think, Mucha, if I may, I think that from a business perspective, there is a lot of questions that come through that says, okay, so now they've eased the lockdown. What do we do as business people? How do we go out there, and what can we do? And you've literally got to, we've got articles that are coming out constantly, whether it's from McKinsey or whether it's from a PwC or the business community, CZI, Business Fighting COVID, all of them have come out with protocols. But the basic protocols of making sure you support your workforce, you really invest in HR, in making sure that you're supporting your workforce, and that when they do come to work, they are stringent. We have to be disciplined as leaders, as business leaders, to make sure that we've put in place things like the rules, and that it's public, where people can see that if they come to this place, they're going to have their temperature taken. So make sure, as a business owner or as somebody that's running a business and you want to get back into it, that you're doing temperature checks, that you're doing the sanitation, you're washing hands, you're wearing the masks, you're social distancing, you're not just touching things that you shouldn't be touching. And, you're because you've got gloves on, you think that you're safe. It's better to actually wash your hands more often than to wear gloves that are then not taken and thrown in the bin, even just on wearing masks. In fact, today we received these Sotzim masks, by the way. They were donated. As you can see, they were donated by Lara Tate, and we have white ones and blue ones. And we're going to be able to give these to some lucky people who will be winning some of these today. And so there we go.
I'll have one of those, please.
So, Mucha, if I may, so you can tell that even though we are pushing 120% to get the hospitals up and running, we also have this huge desire for people to help us to prevent spread or to prevent themselves from getting sick. So prevention. Education is going to be required from the lowest to the highest level person, because you'd be surprised that the people you think are aware of what's required don't actually know. The ones who are the most educated don't know. So like Karen said, prevention is what we desire the most, because our health systems are not yet quite there. And when our health systems are there, they shouldn't just end up being COVID. We want it to last a lifetime. Post-COVID, there's life post-COVID. So we're living within COVID, and then we want living after COVID. And that's what Sotzim is aiming.
So you two have kind of kickstarted, you've inspired my rounding exercise. Last time I asked you to do a rapid response. Today, I'm going to ask you to give me your top tips of what next post-lockdown. And this time I will start with you, Darlington.
Okay, good. Well, again, you know what? I'm passionate about this, Mucha. I'm passionate about it. This thing with COVID, for whatever it's done to us, one of the things it should do to us when we finish dealing with COVID is that the unity that we're showing in COVID, it should be the unity that we're showing in our nation. Our nation should come together, white, black, Debele Shona. It's important for us to be able to pull in one direction. If we can do that, this country has all the resources for us to lead this country to those high destinies that it's called.
What's next for me is we're getting to a place where we'll be reviewing our strategy, because it was just like a kicking off strategy. But I think some of the questions that have come from you, Mucha, around welfare, well-being, etc., mental health, are things that we need to be considering now, because this pandemic is multifaceted. Because what it has done is it has affected livelihoods, it has affected businesses. There are certain businesses that may not reopen after the lockdown. So to begin to look at ways and say, how do we help in those areas? Because there's definitely sort of conversations that are not being held in our country around the effects of COVID beyond just being a public health issue, but being an economic problem.
So I think for me in the post-lockdown period is the critical issue of remaining informed and educated about what is a logical approach and what is an illogical approach. And the logical approach is maintaining the enhanced social hygiene to prevent the spread. The logical approach is keeping people educated and aware of the risk of COVID spreading in the country. And a logical approach is to try and prevent us from getting to the stage of needing multiple ICU beds, because we could, if we're very careful and united as a nation in our approach, maybe avoid the terrible scenes that we're seeing elsewhere in the world. I mean, it just seems like a very strange creeping towards something as opposed to what we've seen in other countries, which is an escalation. But I think for me the most important message post lockdown is that we need to keep ourselves really on the ball with what's happening to ourselves as a country. Are we being able to make collective decisions, or are we being bullied into situations where we are so fearful that we've become dysfunctional? And it's really important for people to get back into their lives and to be functional and feel as though they have some control over most of their lives. And I think that's, when we're talking about mental health issues, part of mental health is knowing that you have some control, and you can't function well or relate well to people when you feel you're losing control. And that goes with the healthcare workers, it goes with your bus drivers, your till operators. Everybody needs to feel that they have some choices left.
My message is really for people to be very cognizant about their own well-being as well. Make sure that you are eating well, make sure you're exercising, make sure you're building up your immunity. Because if you do that, that alone is helping the next person that you're going to interact with. It's so important to make sure that your diet, your health, your well-being, your hygiene, things like just washing your hair. We can't. Isusu wanwatema. Tinofana kugeza musoro wetu. It's really important, because it's incredible how much of disease gets into the hair. And if you don't wash your hair, it sits in there and it goes into your scalp. So let's look after ourselves from top to bottom. Really, really important to make sure that our self-hygiene, our immunities are boosted. We've got amazing things like Zumbani tea and garlic and ginger and all these natural remedies. It's for another program where we can talk about the natural remedies, and we can talk about going back to school and education and sport and all of those things. So there's many layers, but more than anything else, look after yourselves and your loved ones. Give your children immunity boosters and so forth.
And I've left the lawyer for last, just in case she wants to clean up anything anyone said. Nelly, what do you have to add?
Well, this one is more from being a mom, and post-lockdown, can the schools please open quickly? And obviously in a responsible way. And if they don't, how do we reach those who have no access to internet? Things like that. But yeah, we need to have a life after COVID and a life during COVID.
We need to have that transitionary life as well. So we will talk about education, we will talk about our digital capabilities in Zimbabwe. These are all 4 series to come. So please do follow Sotzim, Make Your Mark, every Thursday at 6 p.m. Zim time. I want to say a big thank you to all our panelists. I think we've reached the top of the hour now, or just about. Thank you so much for your time. It's always really interesting to listen to you all speak and to understand the contributions that you're making in the fight against COVID-19. To anyone who's asked questions that we've not been able to respond to, bear with us. We typically have a bit of an agenda, and I like to talk quite a bit, so I might go off script and not get to read all of them. But I'm sure if it hasn't been addressed, somebody will get back to you. So thanks again, everyone, and we'll see you next week on Thursday.
Thank you, Mucha.
Thank
Fabulous
you.
as usual. Thanks, Mucha.
Thank
Thanks,
you.
Mucha.
Good night.
Good night, everybody.
Right.